Hi, and welcome to the informational video webinar series on the rules for certified child care centers. This is video number 16 covering medications and care of children with special needs. My name is Amy Ybarra. I work for the Child Care Licensing Division as a licensing specialist in the Redmond unit. The Child Care Licensing Division hopes that you will find these videos informative and supportive in learning about the new Certified Child Care Center rule set. During each video in the series, we will explain some of the key features and highlights of the Certified Center rules. Another new aspect is that the rules have been organized differently to help make information easier to find. While we are highlighting many key features, changes, and new rules throughout this video series, the entire rule set will not be reviewed. Please refer to the Certified Child Care Center rulebook for the full list of requirements and rules. Okay, let's get started. First, we will review rules regarding medications. Before a certified child care center gives a child any prescription or non-prescription medication, including but not limited to pain relievers, cough syrup, and nose drops, the center must have a signed, dated, written authorization by the parent or parents on file. For chronic medical conditions, a certified child care center may obtain permission for 12 months or less and over-the-phone permission for single-dose non-prescription medication. Parental authorization over the phone is permitted for single-dose administration of non-prescription medication. The date and time of the consent must be documented and signed by the parent upon picking up their child. A certified child care center must ensure that the original container is labeled with the name of the medication, dosage, and directions for administration and storage. Any medication provided by the parent must be labeled with the child's name. For prescription medication, the label must include the child's name, the date the prescription was filled, the prescribing physician's name, and length of time to give the medication. If parent instructions differ from the container instructions, a certified child care center must have a licensed physician's written instructions for that medication. Medication must not be administered after the expiration date. A certified child care center must immediately document any medication administered, listing the name of the child, type of medication, date, time, and dosage given, any side effects exhibited by the child, and the signature of the person administering the medication. A certified child care center must inform parents daily of all medications administered to their child. If medication is provided by the parent, a certified child care center must administer medication only to the child for whom it is intended and follow the directions on the label. An annual authorization from a parent for non-medical items, such as sunscreen, is needed, and documentation of application of sunscreen is not required. Aerosol sunscreen is allowed and must be applied according to the manufacturer's instructions. A certified child care center must ensure medication is inaccessible to children. When it is kept only out of reach but not under child safety lock, it must be in a container with a tight-fitting lid. A certified child care center must keep medications requiring refrigeration in a separate, tightly covered, leak-proof container, clearly marked medication, and inaccessible to children. A certified child care center must develop a written allergy care plan at the time of enrollment, or when an allergy is identified for each enrolled child who has an allergy that poses a threat to the child's health, safety, and well-being. The plan must include instructions regarding the allergen and steps to be taken to avoid the allergen, signs and symptoms of an allergic reaction, and a detailed treatment plan including the names, doses, and methods of prompt administration of any medication in response to allergic reactions. In addition to the allergy plan, the parent must be notified immediately of any suspected allergic reactions or if the child consumed or came in contact with the allergen, even if a reaction did not occur. If epinephrine is administered, emergency medical services must be contacted immediately, and Child Care Licensing Division must be notified within 24 hours. Now, we'll review care of children with special needs. When caring for a child who has or is at an increased risk for a chronic physical, developmental, behavioral, or emotional condition, a center must have a written care plan that contains all information program staff may need to ensure the program can meet the child's needs. If the individualized service requires the child be out of direct supervision of child care staff, parental permission is required. Child Care Licensing Division has created a document to help you with this rule. Our form is not required, but it might be a place for you to start. You can access it from our resource page or ask your licensing specialist for form number PR-0491. The written plan must include a list of the child's diagnosis, contact information for the primary care provider and any relevant subspecialist, for example, endocrinologist, oncologist, or others, medication to be administered on a scheduled basis, medications to be administered on an emergency basis with clearly stated parameters, signs, and symptoms that warrant giving the medication, written in a language that is easy to understand, procedures to be performed, and person responsible for training staff members. The written plan must also include allergies, dietary modifications required for the health of the child, activity modifications, environmental modifications, stimulus that initiates or precipitates a reaction or series of reactions or triggers to avoid, symptoms for staff to observe. Additionally, the written plan must include behavioral modifications, emergency response plans, both if the child has a medical emergency or special factors to consider in a programmatic emergency like a fire, any necessary special skills, training, and education for staff and the person responsible for training staff members. Thank you for watching this video in our informational series. You can now move on to the next video in the series. If you have any questions, please contact your licensing specialist. For more information, visit our website at www.oregon.gov/DELC.